Good, thank you. Very inspiring talk that you had today.
Well, thank you very much. That's very kind.
Yeah, but it all sounds so easy when you're talking about digitalization of all areas, maybe except for healthcare. But how are we going to really implement all that in healthcare?
Well, I think the first step that we should take is to no longer think only about healthcare, but transition into health, because that's a bit easier to do. It still is tough. It's a big challenge, of course. But the healthcare part at the back end of it is way more regulated. We have more issues on finance. And I think we can achieve more, not only at the preventional side, but to think also in other partners, like in the retailization of healthcare, where we also could make good use of retail companies that are out there already, where our citizens or patients already come on almost a daily basis. And we still try to think that healthcare is something like an island. And that island thinking should stop, I think.
So you think inviting retail companies somehow into healthcare could maybe be the thing?
Well, we certainly could learn a ton from them in terms of the user interface and the way how they communicate with their consumers. And let's also be honest that patients in the rest of their daily life are also consumers and citizens. So they are used to use those kind of interfaces and touch points. So why not also start to utilize that one as well? Yeah.
But if you ask a healthcare provider that you should not focus too much of the actual disease and problem with people, but you have to focus more on prevention and everything. I think everybody can, relate to that, and that would be great. But how could they put the money and effort into doing that when they don't have it, to help people and surgery, everything for what they already have?
So that's a good question. The thing is that if you ask a healthcare provider how he or she should work on the prevention aspect, that's not what they've been trained for. That's also not what they are being paid for. So I think we need a paradigm shift, and the paradigm shift also getting in front of the problem as opposed at the back end. And if you keep talking with healthcare providers on how they should fix the prevention aspects, you're talking to the wrong people. That's why I think you should talk to governments, municipalities, and also to retail organizations, in my perspective, where they, for instance, could be creating a model where the things that would be bad for my health would make more expensive, and the things that will be beneficial for my health would be make less expensive. Because we all know that the healthy, good food is way more expensive than the unhealthy stuff that you can buy on every corner. So talking to healthcare providers on that prevention aspect, I think you're talking to the wrong people.
Mm-hmm. So maybe work with nudging and other things.
That's it. Yeah. It's not only nudging, but it's one of those aspects. And why is it that a tech company kind of seduces me into buying the latest iPhone every time? Let's imagine that we could use that methodology also for patients to adhering to the treatment that we've agreed with them, or to make sure that they don't run into these kind of things.
Mm-hmm. Sounds lovely, but
it sounds lovely. I think it is, and again, it's. I'm not saying that this is easy, but the current trajectory with a bit more efficiency and a bit more quality is not bringing us where we should be. In 2040, we have a doubling on healthcare demand. We have shortage of skilled personnel in the Netherlands alone for 175,000 nurses, and we have declining budgets. I don't know how you're going to fix it otherwise. So we need different approaches. So this is not the approach. It's one element in that jigsaw puzzle that we need to start laying out, I think.
But what about getting paid for actually work with prevention in healthcare?
Well, that's something that is not on the table yet. You get paid for interventions, for things that you do. You don't get paid for things that you don't do. So that's the paradigm shift. So that's also where I think that healthcare insurance organizations, governments should start working with organizations that could play a role in that and still paying the healthcare professionals for the things that they do, which will become more complex, I think, than we have nowadays, with, again, a doubling on the number of people that you need to treat within the same time. So you also have to make it easier for the healthcare professionals as well.
Can you tell me a little bit about yourself? Who are you?
Who am I? So I've been in healthcare for over 45 years. At first in acute healthcare, ambulance services, dispatch centers, then transitioned to Radboud University Medical Center, responsible for the trauma helicopter, the acute healthcare. And then I set stage for an innovation center, the Reshape Center in Nijmegen, which was on the convergence of technology at one end and patient empowerment at the other. And that's where we started to collaborate with tech companies and other branches as well to find new solutions other than the ones that we already are using. After 12 great years, it was a blast. I again quit my job. I started to help companies like Vodafone and Deloitte and others not employed by helping them advising and finding solutions on a global level. I still work 1.5 days in a hospital in my own hometown in Roermond, and it's lovely to, on a daily basis, still have boots on the ground for that. But I like to emphasize and explore the things that we could do, not today and not tomorrow, but let's say the day after tomorrow, and try to translate that into what we do now. So 7 or 10 years ago, I was heavily involved in this whole digitization and e-health scene in the Netherlands and in Europe. And I think this is a vast majority that's working on that now. And now we need to look into what's next. And I think working from a new paradigm where prevention, possibly the role of retail, and also the way that governments and insurance companies are paying for the services need to change. But that's what I try to do.
Yes, thank you. And today you were the keynote speaker at the EIT Health Summit.
Yeah, I was honored to come over here in the Aula Medica, which is a great place, of course. And the thing is that digitization still is key, but we need to up our game to the front end of it. So now digitization is on the healthcare part. Let's also bring digitization in the health part on that and try to prevent things, because it was also one of my messages. The things that determine your health is for 20% is your genetics, and then where you were born really matters, and then your behavior. Only 6% of your health is being determined by the medical interventions. And that's where 90% of the budget goes in now. So there's something odd in there. And I'm not saying that's the solution, but it's at least one of the things that we really should explore. And if you talk to patients and citizens, they totally think that this is normal. We in healthcare still try to think that we're different and that healthcare is different. That's also what taxi industry thought and what the travel industry thought, to be honest.
Yes.
So let's not become one of those.
No. And so more health.
More health, better health, yeah.
Thank you. Thank you.